Type 2 diabetes and pre-diabetes are conditions that influence a huge number of individuals. They can prompt coronary illness furthermore. Stroke, which are the first and third driving reasons for death, and inability in the US separately. Individuals with diabetes and pre-diabetes can foster issues with their vision furthermore, lose feeling in their appendages, they may become ill with liver and kidney disease, and in danger for stroke and cardiovascular failure. Anyway, type 2 diabetes and pre-diabetes can be kept away from, and chance can be switched. Diabetes. What is it? Diabetes is a complicated sickness that influences many pieces of your body, however, is brought about by the manner in which your body misuses the things you eat following a meal. Food is broken down. Sugar particles, called glucose, goes through the digestion tracts into the blood, where it reaches various region of the body, and is utilized for energy. There are a few pieces of your body that need assistance retaining the glucose molecules and call for a particular hormone called insulin. Insulin is framed in the pancreas and courses in the blood with glucose to the particular cells that require assistance: liver cells, fat cells, and muscle cells. At the point when the body creates protection from insulin, expanding measures of insulin are essential for it to have the option to use glucose at first. During insulin obstruction, the pancreas will put in extra effort to produce more insulin. This can happen in any event when your glucose levels are moderately. Typical in the event that tests uncover strangely high insulin levels, a condition called hyperinsulinemia. Alongside insulin opposition markers, your body shows beginning amble for creating diabetes. Also, a loss of insulin in the blood influences the creation of lipids and lipoproteins, which are the little particles that are separated from cholesterol particles and fat items called fatty substances. These particles are sufficiently little to go in your circulatory system, however, can be risky in enormous sums when they develop in your veins within the site of raised degrees of insulin. Your body, particularly your liver, delivers terrible cholesterol particles such as VLDL, and the higher your insulin levels, the more awful cholesterol particles are flowing in your circulation system. A condition called dyslipidemia. Besides adiponectin, a chemical delivered by your fat cells that helps separate lipids, specifically free and saturated fats, is many times low in corpulent or, on the other hand, insulin-safe patients. Preceding creating type 2 diabetes, while such lipid and lipoprotein markers are customarily tried to quantify cholesterol, they likewise give adroit hints on the degree of insulin resistance. The pancreas will eventually become specialized beta cells and overworked that produce insulin will start to kick the bucket. A few tests will quantify how well if beta cells are functioning. Showing strained beta cell brokenness implies that your body can never again make sufficient insulin to assist your cells with taking up glucose for energy, and elevated degrees of glucose will remain in your blood. A disease known as hyperglycemia. At the point when insulin levels are low, your body may respond in various ways. A portion of the cells that utilization insulin to control glucose levels have the capacity to hold on to glucose. Cells in the liver and muscle will begin to discharge, put away glucose when insulin levels are low to give the body energy. Without sufficient degrees of insulin, in the presence of insulin opposition, more glucose is delivered into the circulatory system, and the impacts of hyperglycemia are uplifted markers of glycemic control, typically estimated during times of fasting when your glucose ought to be low. Test results that illustrate glucose levels that stay high are the characteristic of diabetes that defines it. What's more, diabetes. To sum up how diabetes fosters, we should survey the principal highlights. High insulin levels mark the start of insulin opposition, the essential component that prompts pre-diabetes and diabetes. Lipoproteins with abnormal levels of lipids. What's more, the chemical adiponectin may further indicate resistance to insulin. A drop in insulin creation by the pancreas happens from burden on the chemical creating beta cells, and beta cell brokenness ultimately prompts an insulin inadequacy. Without sufficient degrees of insulin, your body's capacity to control glucose levels is thrown off, and blood sugar levels rise, defining when prediabetes first appears, and diabetes an excessive amount of glucose circling in your blood, hyperglycemia, and an excessive number of unsafe lipids flowing in your blood to diseases are dyslipidemia, and normal for prediabetes and diabetes. Left untreated, they cause serious harm to the veins, prompting various difficulties. Abundant levels of lipids and lipoprotein particles can develop to make a plaque in your arteries and veins. This is uplifted within the site of abundant glucose atoms and free greasy acids. Because of a blockage in your blood vessels, can't circle to your appendages and the nutrients and oxygen that you carry your body.